Hello, and thank you for tuning into McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And tonight we're going to get to general questions. But first, we are going to talk about the latest news from you, Dad, Dr. McDougall. Nice to see you both. How are you?
Oh,
we're good.
I'll tell you, Heather, it was one of those weeks, or actually it was 2 weeks, wasn't it?
Yeah.
Yeah,
So it's one of those, it was one of those 2 weeks where, I ended up with too much news. So anyway, I'm going to try and go some of the important things. I sent you some references to some of the material. People can look it up. I may not get to all of it. I wanted to talk to you about the semaglutides again. You know what they are. They're the most popular thing that's going to change this world. But the question is do we want it to change it in that particular direction? I mean, you see how drastic the business of making people sick using drugs like Ozempic and Wegovy and Zepbound and your favorite one.
Well, Mounjaro
Mounjaro,
the same as Zepbound, I think.
Yeah, it just depends. One's for diabetes and one is for weight loss. Same drug companies, Nordisk, Nova.
They don't take
Nordisk.
any out of it or anything? They just
No, it's got the same drug, just a different name. One's for diabetes, like Ozempic is for diabetes and let's see what's the one for Wegovy. Yeah, Wegovy, and then you have the same thing
and then
with
Mounjaro and
Zepbound.
Zepbound.
Yeah, same
Okay.
thing. Both made by the same drug company. So there's only two drug companies. There's Novo Nordisk and Eli Lilly. They're the only ones that make the drugs legally. They're the only ones that publish research. All the research, none of it's independent. It's all done by these particular drug companies. And, it's going to make drastic changes. But the question is, isn't there a better way to make these changes that are going to occur? And I think so. And I think it's our program. It's the McDougall diet in comparison to the semaglutides, which are, these weight loss drugs that are by pills or injection. First of all, if you look at the 1 year weight loss, they're similar. We get a 22-pound weight loss. They get a 25-pound weight loss, but they start in their studies, they start at a higher body weight. It's 233 pounds. They start out on average. We start at 190. So you can see, that accounts for, say, 3 pounds. So let's just say the amount of weight loss in a year is the same. You don't stop losing weight until you hit trim body weight. And that's probably thinner than you imagined. And I use in my November 2015, I use weight charts by Walter Kempner. And when you look those up in my November 2015 15 newsletter, you'll find the kind of weight that you'll eventually end up on if you follow the kind of diet we recommend. Anyway, they reach a plateau when you take these drugs, reach a plateau and the body says, look, I'm going to die if my hunger drive doesn't become at least dominant enough to keep the body working. And so you reach a plateau of about 37 pounds. And that takes a little over a year, about a year and a quarter to reach that plateau at 68 weeks. You don't lose any more weight after that. You lose weight until you hit trim body weight on the McDougall program. You stop losing weight when you take these drugs. It's called a plateau. The drug companies know about it. They don't have any way to overcome it. So you don't want to reach a plateau because many of you really desire to reach trim body weight. All right, so the appetite is satisfied, enhanced, enjoyable. The semaglutides, they work by suppressing the appetite. People enjoy our meals. I mean, you may have to take some time to adapt to them, but basically people love what they eat when they eat the starch-based diet we recommend. And they lose interest in food. They lose what they call the food noise. And actually they become nauseated, develop vomiting and diarrhea and gastrointestinal distress to the point where they can't eat. But that's the desired effects. They look for this nausea and vomiting and diarrhea. We look for feeling good. As far as pregnancy is concerned, our diet is an ideal diet. You can go to the January 2011 newsletter, and I'll talk to you about the ideal diet, McDougall newsletter, for pregnancy, and it's the diet I recommend. It's because 99.99% of the people that were born on planet Earth were born to women who followed a starch-based diet. Basically the McDougall diet. And it's contraindicated on these drugs, pregnancy is. You don't want to do that. Cost, you reduce food bill depending upon whether you eat at home or you eat out, somewhere between 20 and 80%. The drugs alone cost you $1,000 to $1,400 a month. You spend $17,000 to lose 38 pounds in 68 weeks. Oh my goodness. When you stop the drug, you'll regain the lost weight, but yeah, you'll regain the lost weight if you go back to the rich diet. But the temptation isn't there. And we've proved it in our studies. People are compliant with our program for a year at a rate of 85%. That's research that's published. Well, research is published also on taking these semaglutides. And what happens is that the compliance rate is only 50% at the end of a year. Ours is 85% of the people are still following the program. You require medical oversight. And the goal of the program that we're teaching you is to get away from the medical business, not to have doctor's appointments littered on your calendar and have to remember every day to take medications. It's to get you away from the medical business. Of course, with these drugs, you end up having frequent medical visits. There are life-threatening side effects. Now, they don't occur commonly on these drugs, but they do occur. People have died as a consequence, gotten cancers. With our diet, it's just the opposite, the McDougall diet. We reduce comorbid conditions like high blood pressure, diabetes, and heart disease. Well, so do they, but they do it by eating less food and losing weight. We do it not only by losing weight, by eating the right kind of food, and the body heals. The program that we teach is planet-friendly. It's a way to save the planet in a necessary way. And yet, when you're taking these drugs, you're still eating planet-destroying foods from the animal agricultural businesses. And as far as animal kindness goes, when you don't kill and eat animals, you're pretty kind to them. When you do, you can only come down to cruel. Anyway, I've had to start a new page. And so let's go on. And I'll continue every week when we get together. I'll update this page. Okay, what I found out this past 2 weeks was that not only do these two drug companies own the patents and all the research done for these drugs, but they also bought the delivery devices, the syringes. They have control over the delivery devices. They plan on taking over the planet. They plan on being, if they're not already, the most important, profitable business in the world. That's their goal. The really concerning thing that came out this past 2 weeks is that you lose muscle mass, you lose strength. And this is particularly important as people get older, because older people are so susceptible to falls and fractures. So you're going to lose muscle mass when you take these drugs. And on our program, triathlons and marathons are won by people who follow a starch-based diet. I pointed out to you many times that the past 4 marathons that I can think of, New York, Chicago, Honolulu, and I don't know, another New York marathon, were all won by people from Kenya who eat 80% of their diet is starch, is corn. You don't have any change in your desire for alcohol or cocaine or heroin or tobacco when you follow the McDougall diet. Man, that's, you could say there's an advantage of these drugs. These drugs make you so sick you lose desire in pleasurable things like coffee and alcohol and heroin and tobacco. So you can look at it from 2 points of view. Now, this is really an important one, is that these drugs cause you to have erectile dysfunction and lose interest in sex. And the reason most people have erectile dysfunction is because they close up the arteries to the penis. And of course, the diet that we teach not only opens the circulation to the penis, so erection is more likely possible and harder in the sense of physically harder, but also you're more attractive. You have more endurance. I mean, a good sexual act ought to be close to a marathon and expended extra energy. I don't know about you folks, but anyway, kills your sex drive, kills your muscles. And those are the new research that were reported to me in the last 2 weeks. But there are some things that we share in common between the McDougall diet and these semaglutides, the approach of losing weight by taking Gila monster poison. You know that whole story. And that is that both approaches are harmful for the food industries, particularly the meat and dairy industry on our program. But all food industries, restaurants, et cetera, they're harmed by people following our diet or following this appetite suppressing drug regime. People don't buy as much food. And they because they lose weight, anytime you lose weight, you decrease your incidence of diabetes and high blood pressure and heart disease. You know, it's hard on the doctors and the hospitals. You may find hospitals going broke. And I mean, this is a prediction that's out there about the semaglutides. And same thing with carrying people around. I mean, what it is right now, when the average passenger is like, I don't know, let's just guess it's 233 pounds. That's a lot of weight to put on an airplane or a train or a car. So in both approaches, we have an outcome of having lighter passengers that are easier to move around. But that's the things we agree about. All right, let's see if we can move along here. Anyway, I'm going to show you this chart. We're going to put it up so that you can get it and show it with friends who say they're desperate. Well, how desperate are you? Are you so desperate that you do the things in the right-hand column, or would you like to do it the easy way, the permanent way? All right. So deadly dietary deceptions that came out, and I want to talk to you about a few of these. We're starting a series actually on deadly dietary deceptions. I wrote one that's going to appear on our Diet Climate website shortly. It's about oxalates being high in vegetables, but somehow vegetables don't cause calcium oxalate kidney stones. So foods that are high in oxalate, why don't they cause kidney stones that are made of oxalate? Well, I'm going to explain it to you why. Another deadly dietary deception has to do with alcohol. I mean, how long have we been told that it's important to drink wine, particularly red wine, because of the resveratrol and other positive things about red wine? It reduces your risk of dying of heart disease and all kinds of things. You know, you like to hear this because people love to hear good news about their bad habits, but that's not what the current research is showing. You know, good research, important research shows there's no reduction in overall mortality by drinking alcohol. And it raises blood pressure drinking alcohol and increases your risk of heart disease and arrhythmias like atrial fibrillation. And I put the research papers for you in the chat so you can look them up. This is the current stuff. So, you know, believing that drinking alcohol is good for you, well, you know, for 9 out of 10 of you, it's not a real problem because you drink for social reasons, enjoyment, relaxation. But 1 out of 10 of you, you destroy everything around you. Auto accidents, falls, abuse, etc. And that's the problem with alcohol. It's alcoholics. But don't go out with an excuse that it's good for your heart, because that 1 out of 10 people who's an alcoholic goes and says, well, my doctor said I should be drinking wine. And what's the future? Just devastation. Anyway, it was nice that these articles are coming out. This was out of the, I believe, the New York Times. Anyway, they did an article this is on the Washington Post, on hemorrhoids. And I thought this would be a good thing to talk to you about as the main topic. You didn't even know I was going to talk about this, did you?
But I read the same article, so I know, I recognize the picture.
We all should have hemorrhoids. Here's how to keep them happy. And so we want to learn about a little bit about hemorrhoids tonight. Hemorrhoids are a consequence of the rich Western diet. They occur in populations that eat a high meat, high dairy, low fiber diet. They don't occur in populations that eat the kind of diet that I recommend. In rural Africa, people didn't have hemorrhoids. And I've talked to you about the studies of people in rural Africa. What happens is when you eat the rich Western diet, it's a diet that's low in fiber. And fiber is the carbohydrate that persists all through your intestinal tract and ends up making the bulk of the stool. And they talk about fiber in the article that I just shared with you and how important fiber is. Well, there's no fiber in any animal products. So pork chops, cheese, beef, chicken, fish, no fiber at all. And then a lot of the starches we eat are deficient in fiber because of the processing, like white rice and white bread. So instead of eating 68 to 120 grams of fiber a day, like Mary and I do, and most of you do, the average American eats 8, maybe 10 or 12 grams a day. And so what they do is they end up with nothing but dead cells and, a few non-digestible parts of the food passing from the stomach through the small intestines and into the large intestines. It's just a little bit of stuff. And you've got to make a stool out of this. And what you end up making is a stool with very little volume. You make what I call, well, it's not a rock hard fecal marble yet. You got to suck the water out of it, and then it becomes a rock hard fecal marble. And you got to pass this tiny little stool. And to do that, you have to put a lot of strain on the body. I mean, you remember the picture, if you've seen it in your family or friends or whatever, yourself in the mirror, of sitting on the toilet, grunting and groaning, pushing blood up into your face, having your face all turned red. Well, that kind of pressure is destructive on the body. What happens is when you grunt and groan and strain, not only do you push blood up into your face and your face turns red, but you push blood throughout the whole body, including the veins that exist at the last part of the intestinal tract. These are called hemorrhoidal veins. These veins are there for social reasons. They keep you from passing at inappropriate times stool and gas. They form a cushion, a barrier. Well, what happens is by grunting and groaning and straining, you force blood into these natural veins, these important veins, and they stretch out and they dilate, and they end up hanging out your butt. That's what hemorrhoids are, is they're just dilated veins hanging out of your butt from grunting and groaning and straining on the Western diet. They're not from cold toilet seats. They're not even really from getting pregnant, even though that's a time when you grunt and groan and strain. Women who follow the starch-based diet I recommend don't get hemorrhoids, even after having a dozen babies. All right, that's how you get hemorrhoids, but you cause other problems related to the formation of hemorrhoids, and that is when you push blood throughout the body. You push blood into your legs, and your legs, to get blood from the toes back up to the heart, that kind of movement of blood occurs through the venous system, and the venous system has valves. You can see them there in the picture on the left. You see those valves? Well, what happens is by grunting, groaning, and straining, you stretch these valves out and they become incompetent. And then what happens is you have a whole column of blood all the way from your heart to your toes, pushing on these veins, and they dilate into blue worms known as varicose veins. That's how you get varicose veins.
So these are the valves.
Those are the valves, but that's a distorted valve.
Okay,
You see a competent one down there a little further.
okay.
All right. Note a couple of dates here. Heather and I are going to give you, hopefully, a special GI series lectures, and our tentative dates are April 13th through 27th. So if you'd like to be a part of this event, I don't know. Heather, are you going to charge, or are you going to give it away for free?
That's a great question.
All right, well, you decide between now and then. But how do people sign up for the lectures?
Well,
They
we'll
have to be
send
on
out a
mailing
link
list?
where they can sign up.
All right. Well, anyway, you get signed up, you get in touch with us on Instagram, et cetera. And we're going to let you know when this is going to occur and whether it's going to be free or charged for. A special lecture on the GI disease from the lips to the end, just like we're talking about now. All right. When you grunt and groan and strain due to the rock hard, trying to pass the rock hard fecal marble that you make on the American diet, you push on your uterus. The uterus is normally suspended in the pelvis, up high, out of the vagina. When you grunt and groan and strain, you stretch out the ligaments to suspend the uterus and your pelvis. And those ligaments get stretched, and you end up with your vagina hanging, your uterus hanging out into your vagina and out of your body, actually. It's called a prolapsed uterus. Same thing happens with men, but they dilate the veins in their scrotum, and also there are other organs that get dilated in the scrotum that occur as a consequence of grunting, groaning, and straining. And The last thing that happens, you get a hiatus hernia from eating a low fiber diet. You see grunting, groaning, and straining, you push the stomach right here, which is its normal position, supported by the diaphragm. You push the stomach up into the chest cavity. And the lower esophageal sphincter is no longer competent. So you get reflux, GERD, reflux up into your esophagus. And that's how you get GERD. Now, well, all you have to do is change your diet. The hemorrhoids won't go away, but they stop itching and bleeding. The varicose veins won't go away, but you stop forming new ones. The hiatal hernia won't go away, but you stop the indigestion when you change your diet. Through surgery, you can have all of these addressed. Hemorrhoidectomies, varicose vein surgeries, which are brutal, can be, and hiatal hernia surgery. So it's a mechanical problem, which you can have fixed by mechanical means, but you don't need to. You don't need to just fix your diet. All right, let's see what we've got here. The last thing I wanted to talk to you about was this. I saw this article. This is in the New York Times. You know, we've passed the critical points, the 1.5 degrees centigrade that we weren't going to pass to save the planet Earth. So now scientists are thinking of other ways to save the planet. And this, I want you to remember. I want you to write this down. In the New York Times article, they have a way to help this crisis by cooling the planet by putting up an umbrella that reflects or blocks out the sunlight and cools planet Earth. That's what's being recommended. Can you imagine the cost, the danger, the effort that it's going to take to put this shade up there to shadow the planet Earth so that we could cool the planet? You'd say
You have to be able to move it around.
you'd have to launch, I mean, just to put something close enough to the sun to block a significant amount of the Earth, and then to control it and hope it doesn't go out of whack and doesn't do something terrible. But that's the latest proposal, since we're too late as far as getting control of the carbon. I know, I don't want to get into that with you, but we still have to deal with transportation and energy supply, and we still have to basically become a planet where the people eat a vegan diet to save the planet. But anyway, this is what we're going to, all right? And I wouldn't have brought this up to you, except it's important. And that is, here's the way you do it. Write it down, okay? You go to a website called mir.org. And what this is an all-volunteer organization. A lot of students from around the world. And what they've done is a guy named Yitao, scientist, really, really brilliant man. He's developed a way to reflect sunlight right here on the planet with mirrors. And these mirrors are made out of discarded aluminum cans and plastic bottles, and they cost $10 a piece. And we need to cover a small amount of the planet to cool the planet. Here they did it in Freetown in Africa. You can see pictures in the right-hand corner. They put mirrors up on the buildings, and they reflect the sunlight and cool the town with mirrors. Very successful. The problem with this approach, even though it can be done right now, even though if we make mistakes, we can correct it right away, because they're right here on the planet. The problem is it's all volunteers. There's too little profit. Think about it. All right. Heather, I'm happy to go on to questions for you. I bet you didn't know I was going to talk about all that today, Heather.
I didn't, but I put all of the studies that you were talking about in the show notes, so you can all go back and do some further research.
I put studies with you that showed that the Mediterranean diet, which is as close to a respectable diet as there is to our program. The Mediterranean diet is a diet high in vegetables. They promote olive oil and nuts. But it's a healthy diet in spite of the olive oil and nuts. It's a healthy diet because a lot of starch, vegetables, et cetera, on the Mediterranean diet. So when positive things come out about the Mediterranean diet, what you ought to stop and think is, well, the diet would be even more effective if they get rid of the salmon and the olive oil and the nuts, and it would be. And of course, what diet is that? That's the McDougall diet, starch-based diet. Anyway, I put a couple articles in there, one about skin problems, another one, I don't know, I put a couple in there that were very favorable. So, and the research on alcohol is there, the research on the sex drive is there, et cetera. You can read it. Read it. Tell everybody you know about MIR. MIR.org. That's where you go. Heather, what do you got planned for me?
Okay, you ready? Here we go. First
Yeah.
question from Matthew. He writes in and he's wondering if a TSH of 2.7 is worrisome. His integrated medicine provider wants it between 1 and 2.
Wow. Well, there's a lot of variation as to what doctors think. I wrote, if you'll find it on the website, about hypothyroidism. I wrote an article about 15 years ago, which showed that if you had a TSH higher than 2, that you had an increased risk of finding atherosclerosis and heart disease. That wasn't a lot, just a little bit. And so two microinternational units is the goal target that I've been using for a TSH level, 2 microinternational units. Now, if you're above 2, what it means is that you're not producing enough thyroid. You're becoming hypothyroid. And in that case, what you do is supplement with thyroid supplement. And I use Synthroid. I use the synthetic form. I don't use the natural form because it comes from cow and pig thyroid glands. So what you do is you substitute, you supplement, which is true supplementation, the thyroid that your thyroid gland is not producing with pills. All right. And you supplement to the point where the TSH level is around 2. Now, below 2, I've always considered to be overdose. Either you're taking too many pills, too much medication, or you've got a condition called hyperthyroidism, which we could go into, but that's treated with radiation surgery or basically doing nothing, but taking some drugs to get you through a year. And about half of the cases of hyperthyroidism correct themselves in a year. But anyway, that's another whole discussion. So the idea that you need to be 1 and 2, I don't know the evidence for that. I don't really think it exists to any point where I would push it on my patients to try and establish between 1 and 2. Certainly below 1 is too much thyroid. And but there are a lot of doctors out there that don't treat until the TSH gets to be 6, 8, 10. I usually do by 4, but again, it's just a guess based on some pretty weak data. You don't want to have a real high TSH, say below 10. You don't want to have it below 1. 2 is your target. And if you can put reasonable effort into it, then you should be able to. It's something you and your doctor should be able to work out. You should get pretty close to 2. And then check it yearly. At most, every year.
Thank you. Okay, let's see. When you were talking about the digestive system and grunting, groaning, someone wrote in and was making a comment about how too much strain can also cause diverticuli. Is that true?
Well, what kind of? Oh yeah, I didn't touch on diverticuli, did I? I should have mentioned that. I somehow left the slides out on diverticuli. You're absolutely right. Thanks for correcting that. We'll be sure and have that part in the lecture that we're going to give next month on GI disease. It's part of the GI lecture. I don't know why I got missed. Yeah, diverticuli. Diverticuli are little balloons that pouch out from the large intestine. And where they break through and become diverticuli, or little balloons, they call it left-sided appendicitis because it's like an appendix, but occurs on the left side and appendix is on the right side of the body. So you get these pouches, and these pouches, they get infected. And so you get diverticulitis, which is treated with antibiotics and sometimes surgery. And it's a very serious condition. Diverticulitis from getting infected, these diverticuli, just like appendicitis. When you get the appendix infected, that could be very serious. You could die from that infection. Anyway, once you develop these pouches, fluid becomes stagnant in them and they can get infected. The other thing that happens is because these little pouches blow themselves out in the weakest part of the large intestine, which is where the blood vessels poke from the outside of the intestinal wall through the intestinal wall to supply blood to the inside of the intestinal wall. where this blood vessel pokes through the intestine is the weakest area. And so your ruptures occur right next to the blood vessel. And that's why one of the most common signs of diverticular disease is bleeding. As a young medical student, I put myself through school as a surgical nurse. I've been on several operations where the only way we could save the patient's life, because the bleeding was so severe, is to take out a whole big section of bleeding diverticuli in his large intestine. So this can be a very serious problem too. The nice thing to understand is once you change to a high fiber, a starch-based diet, fiber is only present in plants. You got that part, it's only in plants. Fiber is just chains of sugar that are linked together by attachments that are not digestible. That's all. It's just a bunch of sugar that persists through the intestinal tract. Anyway, once you go on a healthy diet, what happens is you stop getting the infections. You got to get over the infection, but you stop getting the infections, and your risk of bleeding goes down to, well, pretty low, real low, extremely low. In other words, you don't have to have anything done. Just fix the food, and the body usually takes care of itself.
Thank you. Next question. I know we talk about this a lot, but it's something that most of us over 50 are confronted with, and that is colon screening. Can you tell us what you recommend, whether it's a colonoscopy? Thank you.
What I recommend for testing, you understand the diet I recommend to prevent polyps, which are precancerous lesions, and colon cancer is the diet where around the world, where people have consumed this diet, there's been no polyps and no colon cancer, okay? Like places in rural Africa or rural Asia. These are diseases of Western civilization. You put bad stuff in the colon gets irritated, it develops polyps, you irritate it enough, and it turns into a cancer. That's basically what it does. Now, the approach, instead of changing the food, which it should be, doesn't cost anything, corrects so many other problems, kind to the planet, kind to animals. Instead, it's early detection. And so what's recommended by various countries is ways of detecting colon cancer and polyps early. And for example, the United States Preventive Services Task Force, in the year 2016, they came out with their last recommendations. And they are, you should have screening done. You can have screening done by a colonoscopy, a sigmoid, or various stool tests. And you can even have it done by a virtual colonoscopy, which is a CAT scan. And they say it doesn't matter. It's not ranked in any particular order. It doesn't matter which of these tests you have. But they do admit the colonoscopy is the gold standard. And they do admit that the colonoscopy is also associated with complications, like they're being killed. Some people die from perforation and bleeding. In fact, the serious complication rate from colonoscopy with polyp removal is a little less than 1%. But that's serious complications, ones that you could die from. Anyway, even though the United States Preventive Services Task Force still considers colonoscopy the gold standard, they tell you it doesn't make any difference which one you do. And so what I recommend people do is the same one that the Canadian Task Force on Preventive Medicine has recommended since the year 2019. That is, you do not get a colonoscopy. Just like in Europe, they don't recommend colonoscopies. The only study done, the only randomized controlled trial done, testing the benefits of colonoscopy was just completed. It was October 27th, the year 2022, in the New England Journal of Medicine. A 10-year study, 58,000 people, done in Poland, Norway, that part of Europe. And they followed these people for 10 years. And they looked at the risk of dying. No difference, whether you got colonoscopy or not. There are no other studies, no other proper studies that support this. And that's one reason why the Canadian government tells Canadian citizens to forego the colonoscopy. Don't do it. So what I recommend is a stool test. That could be blood. It could be a genetic test for blood. It could be something called Cologuard. You know, the regular stool tests for blood are like, $40 for 3 years of testing. The Cologuard is $500-600. That's advertised like mad on TV. Why? Why? Because it's $600. And the colonoscopy is like $3,000. And a sigmoid exam, which has no adverse effects, no anesthesia, no risk of dying, is $200.
Well, don't they say though, the reason that you should get a colonoscopy is if they find something, they can take it out while they're doing it?
Well, then, yeah, you have to do that. But detecting, if you go out and look at millions of people, only a tiny percentage will require to have this more dangerous test, more expensive test. So you clear the vast population of people with stool tests. And then those who turn out positive, like positive for blood, positive for Cologuard, then you need to do a diagnostic, no longer a screening, but a diagnostic colonoscopy. Go look what's causing the bleeding or the positive Cologuard test. So yeah, there's a place for colonoscopy, but it's after. You don't use it for screening otherwise healthy people. When you screen otherwise healthy people, it's something called disease mongering. You take healthy people and you turn them into patients. And the evidence that screening reduces your risk of dying is so poor that I can clearly state to you, none of the screening programs live up to their public reputation, which is they're going to save lives. That means mammographies, so that means breast self-examination, that means colonoscopies, that means stool tests. Well, maybe stool tests. Let's leave that aside for a minute. Lung tests, checking for oropharyngeal cancers, melanomas. None of this has been shown to reduce your risk of dying. And you know why? I've shown you why. Because it's 10 years in the development of this disease by the time it's big enough to find. And if it's really cancer, it's spread. Okay, so in Europe, like I say, they don't do colonoscopies. The only study done, randomized control trial, shows it does not help. It's almost killed the colonoscopy business. They got panicked, those GI doctors did. Deservedly so, but of course the spin doctors have gotten out there and told you why it's not important. Anyway, what I recommend, because the only randomized control trials that show that screening reduces your risk of dying are those that involve a sigmoid exam. 2-foot tube, $200, no pain, no risk, not done by doctors any place that I found them.
Oh, go.
It's just got to be consumer demand. It's got to be the organizations coming out and starting to tell the truth and getting the practice changed. But look, you talk to somebody who's making their money this way. You say, hey, you could spend an hour making $200, or you can spend an hour making $300. What would you like to do? And if you lie enough, you can get away with it, which is what they're doing with the colonoscopy, is they're lying to you. But I think people will realize that the research is the research. And sigmoid does make a difference in your risk of dying. Why? Because you find precancerous lesions, polyps, and there's virtually no risk to doing it. Yes, you find precancerous lesions, polyps with a colonoscopy, but for everybody you save, you kill somebody. Okay? Save one, kill another for perforation or bleeding or anesthesia or some other surgical complication. Overall mortality is zip when you compare the two, not getting colonoscopies, getting regular colonoscopies. October 27th, 2022, the New England Journal of Medicine. Look it up.
Thank you. I'm going to clip that out and save that because I get asked that question every day.
Well, the thing is, you're risking your life. You're spending your day. You've got a preparation that is really as bad as the test as far as how you feel with cleaning out your colon. It's money, it's politics, it's unfortunately the patient is the one that gets harmed. But the doctors are doing fine. No problem at all. We got a whole bunch of them living here in Los Oswego And these great big, what do they call them, McMansions. They're doing good. Don't you worry about them. They're fine.
Okay, next question. This is from Nigel. They would like you to address avascular necrosis.
Well, what that means, avascular, you know what I'm talking about?
No,
No clue.
Okay,
No clue.
avascular necrosis is just where the blood vessels shut down and the tissue dies. Avascular means without vascular supply. Necrosis. And this can occur, I'm trying to think of where it would be described most commonly.
You know, it looks down.
All right, it could get in any place, avascular necrosis, but see what they say is the most common occurrence, or is this systemic? You know, they're talking about systemic disease. Anyway, what causes it? I would think a couple of causes. One is closing down the arteries through atherosclerosis, animal-laden diet, vegetable oil-laden diet. You know, certainly prevented, I mean, really prevented by a starch-based diet with fruits and vegetables. If you don't follow that kind of diet, you start seeing atherosclerosis in infants at 8 months of age. In a study in New Orleans by Holman, published in, I don't know, early 1970s, New Orleans, about 100% of children, 2 years of age, had the beginnings of atherosclerosis. You get into late teens and you have, in the Korean War, 70% of the soldiers killed had significant atherosclerosis. Many had heart attacks. In the Vietnam conflict, one of my professors did this study, a guy named Judd McNamara, showed 50% of the soldiers had advanced atherosclerosis in the early 20s. Motorcycle accidents, they've studied them, the kids, children, you know, the teenagers. You see this. Anyway, that would give you avascular necrosis. The other thing is you can have an autoimmune disease. Now, what did you find there, research lady?
Found that it's associated with long-term steroid use and drinking too much alcohol.
Didn't help me a bit. Didn't help me a bit. I'm sorry, I can't relate to those two. Anyway, you always should approach things from the point of view of fixing what's fixable. You can fix the food. You can fix your drinking habits. You can fix your smoking habits, your exercise habits. You know, you can fix this.
Well, they blame this, they say it's a death of bone tissue.
Well, that's what I was thinking of, is that avascular necrosis of the bone and cartilage and stuff.
Primarily hip pain.
Right. Yeah, they're probably talking about, now you're getting my memory working there. Yeah, avascular necrosis of the hip. But in that case, I can tell you, there's one artery that supplies the hip. Okay, one artery goes up and supplies the ball of the hip. When you close down on an artery, you get avascular necrosis. And now that you put it all in context, I can tell you, before the fire, I used to have research that showed avascular necrosis was caused by closing the single artery down. I could likely find it again, but it's been a long time. So that's what you're talking about. Thank you very much, Mary. Thank you very much, listener, questioner. You brought back the memory of what I remember about it. Avascular necrosis occurs in the hip, and it's due to the single artery that supplies the hip joint.
That's exactly right. Nigel just wrote in and said it's in his mom, who's 91, in her hip. So you're right.
Yeah. You just want to make it hard for me, don't you?
I don't know how you remember all this.
I'm almost 77 years old, folks. You know, give me a 5-second time break. Get my assistant in here to help.
Okay, next question. This is wondering if this can get relieved without surgery. A large hiatal hernia with thoracic stomach. I'm not sure what that is.
Well, that's a hot tough term. What, can you spell it, Heather?
Well, I don't even think it's spelled right. ITHORACIC. That must be a miss.
Well, a hiatus hernia, I just showed you how they occur. When you're constipated, you sit on the toilet and you grunt and groan to pass the little rock hard fecal marble. You know what I'm talking about. You know, your children know what I'm talking about, Heather. You know, they used to laugh at their fellow students in school because They would spend a half an hour in the bathroom, grunting and groaning and straining, making all these horrible noises. And your boys ask, what's wrong with these kids? They make these horrible noises when they're in the bath. They stay there forever. Your kids didn't know because, for them, a bowel movement was a 45-second ordeal and an easy cleanup too. Anyway, when you grunt and groan and strain, you push the stomach, which is in the abdominal cavity. Separating the abdominal cavity from the chest cavity, thorax cavity, is a muscle called the diaphragm. The diaphragm's purpose is to contract and allow the lungs to expand. Through that diaphragm must pass three structures. They're the aorta, the vena cava, which are fixed blood vessels that are fixed to the back wall and go through the diaphragm. Then there's the esophagus, which is not fixed. It slides up and down, which goes from the mouth, the esophagus, through the chest cavity. It has to pass through the diaphragm and, of course, empty into the stomach. But when you grunt and groan and strain, you push the stomach up against this hole in the diaphragm. A dilated muscle is called a hernia. A hiatus hernia is what you call this, because you dilate the hole, and now the stomach sits up in the chest, part of it. And every time you take a breath, because you create negative pressures, when you breathe in, you suck stomach contents up into your esophagus. So how do you deal with this? Well, you fix the food, first of all. Second of all, you raise the head of your bed. Why? Because gravity then works at night to keep the stomach contents out of the esophagus. So you raise the head of your bed 4 to 6 inches, brick or 4x4 or whatever. And you sleep at a slight angle. That's all you need to do, and eat the right food. If you need more, then you take wafer antacids like Tums, or liquid antacids like Tums. Or you take H2 blockers like Tagamet. You're getting serious then, but only when you're extremely, extremely desperate would you take proton pump inhibitors, Prilosec, Pravicid. These drugs are toxic. They increase bone fractures, your risk of cancer.
Well, if people ate the way we recommend, they wouldn't need those, right?
Well, first of all, they wouldn't get the hiatus hernia. It's only a disease of Western civilization. Second of all, you can get rid of the signs and symptoms, mostly symptoms. You know the difference between signs and symptoms? You ever got that right now? Well, this is one of the things I took away from medical school, okay?
Okay.
Signs are things you can see. Somebody else can see. Like a splotch on your head is a sign. Or if I take your temperature, that's a sign, the physical sign. Symptoms are things you have to tell me about.
Oh, okay.
Yeah. Like pain, or you feel hot. That's a symptom. A sign is something that's observable by outside, or you can observe it too. That's why I always say signs and symptoms. It's one of those things.
It's a big difference.
Well, I think it's important.
Well, yeah, because
And
if you can see the sign, that doesn't necessarily mean that what you're going to do to that person or help that person overcome is going to be the same as when they talk to you about what's wrong with them.
you need both. You just,
Yeah.
That's what a history and physical is. History, you learn about symptoms. Physical, you learn about signs. But you know what? The other thing I learned in medical school is if by the end of your interview with the patient, which should be a half an hour at least, maybe an hour, not 7 minutes like it usually is in a typical office visit. By the time you finish the history, you will know what's wrong with the patient. You don't have to get lab tests. You don't have to look them over. You don't have to do a physical. They'll tell you, if you're listening, what's wrong. But you got to listen. If you don't listen, whoever you are, a relative, a medical professional, a nurse, a doctor, whatever, you're not going to find out what's going on. You have to be an active listener. Anyway.
Thank you. Next question. This is from Satan Anarchist. Do you have any insight on what causes dumping syndrome and what might help with it?
Yes, I do. But I have to kind of get the memory going. Dumping syndrome occurs after you eat. What happens is the stomach contents rapidly go into the small intestine. It occurs commonly in diabetics. Okay, you're shaking your head. This must be come along with what the person said. And the thing is it stops. You don't have it on a starch-based diet. It goes away. Whereas you have this, and I'm trying to think of all the mechanisms behind it. Why on the Western diet you have the dumping syndrome, which I've taken care of quite a few people who have the dumping syndrome, who switch their food. They stop dumping. Anyway, that you get a whole bunch of stomach contents that go in the small intestine very rapidly. Your blood sugar can go up and it can also go down right afterwards. You can get diarrhea associated with a rapid dump of stomach contents into the small intestine. And switching to a healthy diet takes care of it. It's been my experience. Dumping syndrome, especially food high in sugar. Well, it's really a motility problem of the gastrointestinal tract that occurs as a consequence of diabetes. They mentioned diabetes there.
What triggers? No, if you eat a meal heavy in starches or sugars.
Well, not starches, but sugars maybe. Anyway, that's what it is.
Thank you.
Fix it by eating beans and rice and corn.
This
How
next
long does it
question is,
take? Well, about a day. About a day, you'll be better.
and up to 4 months, right? Or until you've lost the excess weight.
Yeah. We give timetables. I think it's important for you to understand this. We're not asking you to believe us for eons and eons like the supplement people do. You know, we're telling you that within 24 hours you'll see benefits, and within 12 days, which is the length of time of our telemedicine program, which is the best way to learn. You stay with us for 12 days in your own home, and we give you all the support you need. And Dr. Lim is with you all day, every day, and we get you off your drugs. Our success rate is published. 90% of people will reduce or stop their medications, and people get well. I think within 4 months, if you haven't resolved your problems, your severe inflammatory arthritis like rheumatoid or lupus, or your chest pain from closed arteries, and if you haven't resolved your problems in 4 months, you should go looking for somebody else. Except, as Heather says, if you're overweight still and at a rate of weight loss of 10, 12, 14 pounds a month, some of you have got a couple of years of fat to get rid of, but you will. But Heather, I saw a Star McDougall you sent out this morning. Did he lose 200 pounds, or was that on Forks Over Knives website? I think it was Forks Over Knives.
Okay.
And somebody lost 200 pounds. This is expected. Okay. Jenny Craig, these weight loss programs tell you this is the best case scenario. Nutrisystem, best case scenario. Don't expect this. Of course, now a lot of these programs are giving you a shot of Ozempic or other Semaglutides to get you going, because their programs don't work. I think the average weight loss at 2 years. Not Jenny. There's Jenny Craig, Nutrisystem. What's the other one?
Weight Watchers.
Yeah. Weight Watchers. The average weight loss in 2 years was 6 pounds. Good grief, we get that in 12 days almost.
It's hardly worth it.
So thank goodness Semaglutides, Ozempic, Wegovy, et cetera, came around to help these programs that teach you moderation, to help them get some numbers that they can brag about, because they're not able to do it with what we call reasonable, sensible, moderate eating programs. You want the best, you want the results. We're not going to give you anything other than the best of both. So is it harder? Not much. I mean, think about it. You got to change. You got to learn how to cook differently. You got to learn how to shop differently. You probably have to get new because what's the difference whether you do things right or half right? Or, you've got to change. You might as well figure out what you need change to. That's the best. And make the changes, go through the pain, the suffering, buying new foods, making new friends, learning how to cook differently, learning how to get off your drugs. Just don't sell yourself short. You guys are worth it.
Okay, next question. We've got a few more minutes. I think we can get a few other questions in here. This is from Lori, and she's wondering what you would tell a young woman, 28 years old, who has bleeding ulcers.
I assume we're talking about stomach ulcers.
Yes.
Stomach ulcers. Well, what she's going to be told is she's going to be told she has H. pylori, Helicobacter pylori, which is a bacteria that chronically infects nearly 100% of people who live in underdeveloped countries. 40% of the people who live in Western countries like the US and Europe and Australia, 40% of the people are infected with H. pylori. But the people in parts of the world where we call them underdeveloped countries, where they eat starch-based diets, they don't get ulcers. So you have to have the bacteria along with a diet high in meat and oil and dairy for that bacteria to become toxic and cause ulcers. And so they'll put you on a triple therapy. They'll put you on a couple antibiotics and a proton pump inhibitor. So you take this triple therapy, they call it, and it kills the H. pylori. Guess what? As soon as you stop taking the pills, it comes back. Why? Because your wife or your husband or your next door neighbor has it, or it's every place. So what you need to do is to change the food. Forget the H. pylori. They're just there. And they don't become toxic unless you feed them an unhealthy diet. So, that's what you do. You just fix the food. Now, where I come from, we're talking about a half a century ago, when Mary and I were working in operating rooms, which is where we met. We would take and we'd cut the vagus nerve because we thought it was psychological to have ulcers. It was stress. So how are you going to stop the stress from getting from the brain to the stomach? Well, there's a nerve called the vagus nerve that runs along the esophagus. And so we'd go in there, we'd cut the chest open. We'd go in there and we'd find this nerve and we'd tie it off and slice it in half. Guess what? The ulcers, they healed. I don't know why, because the vagus nerve controls the amount of acid secreted in the stomach. So it's kind of a surgical way of taking a proton pump inhibitor. That's the surgeon's method. You see the correlation?
Yeah.
Oh, that's bad. Anyway, we did that, and then we just take people's whole stomachs out and throw them away. That's the other operation we did, a gastrectomy. But the things were brutal back then, and now all we do is we just give you a bunch of drugs. And
What do they do? Make a new stomach out of the small intestine?
this esophagus became the stomach,
Oh, okay.
but not much. Wasn't very big.
Sure.
They do that now with a sleeve.
Yeah.
They cut 80% of your stomach. They throw it in the garbage can. And they make a tiny stomach. It's a common bariatric surgery these days, is to do a sleeve. Throw 80% of your stomach in the trash basket. You lose weight. Hey, we got lots of ways we could cut off both your arms and your legs so you couldn't get to the refrigerator. There is a weight loss method I haven't heard tried in a while. Cut off your legs and your arms. I figure out some way to get the food. You have these anyway. Heather, we have time for one more question. You're gonna quit on me.
It's time.
All right. You're gonna run a program. It's darn full if it's not full already. When is the next program, Heather?
March 8th. We have a few spots left. If you want to sign
All
up,
right.
you can do that through our website.
Okay.
Otherwise, we'll see you next Sunday at 5 p.m.
I want them to know that this is the kind of thing where you look back and you say to yourself, why didn't I do this a long time ago? So sign up, and we'll also have that announcement for the GI series of GI lectures that we'll give in April. And we've got a couple other lectures I want to give you, and Heather knows what they are. Attractiveness and preventing dementia. 2 more lectures. They're in the can. Just got to put them up. Stay tuned. Thank you for being with us.
Thank you. That was a great hour. Thank you all for tuning in. We'll see you next Sunday at 5 p.m. Pacific. Take care. Bye.
Good night.